Hello everybody, so today I wanted to talk to you about renal failure, aka kidney failure. But before I wanted to talk to you about this, I just wanted to let you know that I've posted several more videos just like these. So if you're like a nursing student or someone that's just interested in diseases or whatever, I've posted several more like couple or multiple sclerosis, autosclerosis, deep vein thrombosis, bursitis, and acne vulgaris, and those are just some that I can list off. But if you're more into history, I did do 2 of those so far. I did women in World War II from the perspective of different countries, and I've also done the Columbine Massacre, which was one of the biggest school shootings here in America. So I just want to let y'all know, if y'all are a history lover or if y'all are a science lover, there's stuff like that for everybody. So let's get into renal failure. So first question y'all might be asking is, what is renal failure? Kidney failure, aka renal failure, means one or both of your kidneys no longer function well on their own. Kidney failure is sometimes temporary and develops quickly, acute kidney failure. Other times, it's a long-term condition that slowly gets worse over time, chronic kidney failure. Kidney failure can worsen to the most severe stage, end-stage kidney disease, which is ESKD, which is deadly without treatment. If you have end-stage kidney disease, you may survive a few days or weeks without treatment. With the proper treatment, you can live a good quality life while you manage your kidney failure. Signs and symptoms: extreme tiredness, fatigue, nausea and vomiting, confusion or trouble concentrating, swelling, which is also known as edema, particularly around your hands, ankles, or face, a change in how often you pee, cramps, muscle spasms, dry or itchy skin, and poor appetite, or food may taste metallic. The guy on the left, you can see that he's itching constantly, which is not good. And then the guy on the right, he's obviously having some discomfort, some pain, where your kidney is located, which is not good. Next one is causes of renal failure. Diabetes and high blood pressure are the most common causes of chronic kidney disease and kidney failure. Unmanaged diabetes can lead to high blood sugar levels, which is hyperglycemia. Constantly high blood sugar can damage your kidneys as well as other organs. And high blood pressure means blood travels forcefully through your body's blood vessels. Over time and without treatment, extra force can damage your kidney tissue. That girl right there, she's like, oh my god, my blood pressure's too high. It should not be 150. And just a little tip. Risk factors. Having diabetes, having high blood pressure, which is hypertension, have a heart disease, have a family history of kidney disease, have abnormal kidney structure, are black, are over 60, have a long history of taking pain relievers, including over-the-counter products such as non-steroidal anti-inflammatory drugs, also known as NSAID. So over here we have a black guy, and then to the right we have an elderly lady who appears to be above 60. No harm with calling that guy black. I'm just stating his race. That is not racism. Racism is when I discriminate against a color of his skin, but I'm not. I'm just stating the fact of what his skin tone looks like. I just don't want to get any confusion. How to be diagnosed with kidney/renal failure. Blood test. Blood tests show how well your kidneys remove waste from your blood. A provider will use a thin needle to withdraw a small amount of blood from a vein in your arm. Technicians will then analyze your blood sample at a lab. And down at the bottom right hand side, you see the girl getting her blood drawn. That's what that's supposed to represent. Urine tests. Urine tests measure specific substance in your pee, such as protein or blood. You'll pee into a specific container at a provider's office or at a hospital. I'm sorry for the notification. Technicians will then analyze your urine sample at a lab. And like I said, at the bottom right, there is a urine test. Image tests. Imaging test allows a provider to look at your kidneys and the surrounding areas to identify abnormalities or blockages. Common imaging tests include kidney ultrasound, CT urogram, and an MRI. Treatments. Kidney failure treatment depends on the cause and severity of the condition. Healthcare providers can't cure kidney failure, and the disease is life-threatening. But treatment can help you live longer and manage any symptoms or complications. If your kidneys gradually stop working, a healthcare provider may use a few different methods to track your health and maintain kidney function as long as possible. These methods may include regular blood tests, blood pressure checks, and medication. If you're in end-stage kidney failure, you need treatment to keep you alive. There are two main treatments for kidney failure: dialysis and a kidney transplant. And on the left side, you see basically what dialysis is. It just takes away your urine out of your kidneys, and I'm assuming that's water in the dialysis bag. I'm not an expert, y'all. Prevention methods. Though kidney failure and CKD aren't reversible, you can take steps to help preserve your kidney function. Healthy habits and routines may slow down how quickly your kidneys lose their ability to function. Monitor your kidney function. Keep your blood sugar levels in the normal range if you have diabetes. Keep your blood pressure levels in normal range. Avoid using tobacco products. Avoid foods in high potassium and sodium. And go to every regular schedule appointment with your healthcare provider. So on the right, you have preventions of kidney failure. These just tell you a few more things. Make sure you're drinking water. Avoid smoking. Controlling your blood sugar. Eat healthy. Do not take over pills. Monitor blood pressure. Exercise and limit your salt intake. Next thing we have, these are the stages of chronic kidney disease. So stage 1 is your kidney is fine, it's working normally, there's nothing wrong with it. Stage 2 is mild loss of function. It doesn't look that bad, it's just having a little problems. Stage 3 is moderate loss of function, which is kind of in between good and bad. Stage 4 is severe loss of function. This is bad. And then obviously stage 5 is kidney failure, and this is not good at all. And here are my two sources that I used. I used my DHO book. If y'all don't know what that is, it's like a nursing textbook that I had in school. And my other source that I use is kidney failure stages, and all that good stuff. Thank y'all so much for listening to me talking about renal/kidney failure, and I hope you guys know something, and I hope this helps you stay on track in the future. Have a good day!